My name is Peng Tiam. I'm Dr. Peng Tiam. I'm the Medical Director of Parkway Cancer Centre. I think the doctor-patient relationship is a very complicated one, and it varies tremendously from doctor to doctor, patient to patient, as well as from country to country. In Singapore, we really stress a lot in terms of empowering the patient to understand. One of the things which I'm very worried about in many of the patients which I see are that they don't seem to fully understand what is happening to them. So it's very important for patients to spend enough time understanding their own conditions. And this can only happen if the doctor-patient interaction time is increased. It is very difficult for a patient to be able to understand what is going on if the consultation is only going to be a 5-minute session, especially in the context of cancer, which is a very complicated condition. It is important from the very first meeting that the patient must understand what is going on with him, what is the treatment plan, what to expect at the end of the day. And this can only happen if the patient is given the opportunity to ask questions. And the doctors must be ready to answer these questions. Because if not, there's going to be a gap between what the patient is thinking and what the doctor knows. So that's why one of the things which I would like to impress upon both the doctor as well as the patient is to make sure that they spend enough time during the consultation. This gap can be addressed in many ways. I mean, firstly, we all understand that the doctor's time is very precious. But no matter what you say, you must give enough time to the patient. And that's where the system can actually help in. If you have a right system, it can make a big difference. In Parkway Cancer Centre, we as the doctor will spend a lot of time explaining about the medical condition. We're talking about the treatment options and why we think that one treatment option is better than another, the potential side effects, as well as where are the checkpoints in which we are going to assess the response to treatment. But the patient actually has many more questions that goes beyond just the treatment and outcome. They want to know many other things. And that's where the holistic care is very important. The patient must have an opportunity to discuss with our pharmacists what are the interactions in terms of the drugs that they are taking for their heart medicines, their diabetic medications. How about food? Will they have any interaction with the drugs that they are taking? So in other words, if you provide a system whereby the patient has the opportunity to interact with different parties within the clinic, the pharmacist, how about your counselor? The patient may be very concerned about his sexual function. Can he continue to have sexual intercourse with the wife? Will he transmit disease to the wife? What should he tell his friends about his condition? Is it time for him to prepare for death? What does he need to know about it? And that's where the counselor plays a very important role. They will help them to understand, how best to interact with friends. And our counselor provides counseling not just for the patient, but also for the caregivers. You must understand that the patients, when they diagnosed to have cancer, they go through an emotional roller coaster. They can be very upset, very angry people. Some are very accepting, but some are not. As a family member, how do you support? As my counselor always says, the best way of supporting is just be there. All right? It's not necessarily what you say, but really just your sheer presence, your show of support for the patient that really matters. Many people think of technology in terms of medical technology. Of course, medical technology is very important, that advances in radiotherapy, your MRI machines, your robotic surgery, but that technology is not what I think is most important. What's important is really technology in the real world. For example, my WhatsApp number is shared with all my patients. My patients, all of them have my WhatsApp number. They know that they can message me. In the bad old days, every time a patient leaves you a message and you've got to call long distance, you've got to pay money for it. But nowadays with technology, you don't even need to worry about the cost of telecommunications. They send you a WhatsApp message, you see it's not something that's urgent, you can just reply them at the end of the day. This morning while I'm here in India, a patient messaged me to ask whether she should lie to the insurance company about her cancer so as to make sure that she can buy insurance. And of course the message is, no, you cannot lie, because if you lie, when the time comes that you need them to pay, they won't pay because you have lied. So these are things that patients need to feel connected to you. It must be a relationship that they feel goes beyond you prescribing medicine and they taking your medicine. It must be one whereby they trust that they can reach out to you even for their smallest problems. I think that's how technology can make a difference. Using technology, we can actually make our lives as doctors easier. You don't have to worry about the phone calls that come in that interrupt your practice. Through messaging, you can actually reach out to them at your convenience and responding as appropriately or as urgently as is needed. We are very big on this word holistic care. In fact, the other word that we love a lot is patient-centric care. We all work together as a team to ensure that the patient has the best possible treatment and care. All right? We have, even in India, which is far away from Singapore, a Can Hope office. We have a Can Hope officer here where patients are able to reach out to. You don't have to pay for his services. He can help you in terms of understanding, some of the side effects that you are encountering. He can help you to connect with your doctor who is back in Singapore. He can help you with your travel plans, etc., etc. That's how far we go. We've Can Hope offices throughout the region, in Indonesia, we have them in Vietnam, in Philippines, in Myanmar, in Malaysia, and of course in India. So this is the way in which we feel that it's important that the patient continues to remain connected to us, even though they've gone back home. As part of our team, among the 15 doctors, one of us is actually a palliative physician. And it's very important because while we are busy talking about how we want to attack and kill the cancer, control the disease, prolong life, it's very important that someone that helps to address the patient's symptoms. What do I do about my loss of appetite? What about the pain? Is there any way in which I can make sure my pain is better, I can enjoy a better quality of life, even while I'm undergoing cancer treatment? So that's why a palliative physician is part and parcel of our team, and that's how we ensure we give this holistic care, patient-centric care that we talk about. An ideal consultation is a consultation whereby the doctor is able to extract the important information from the patient, all right, for him to be able to make an appropriate decision in guiding the patient. All right. An ideal consultation is one whereby the patient must, at the end of the consultation, understand his or her condition and be able to ask questions to address his or her concerns. I won't be so brave as to say I know what is an ideal doctor. I think we all aspire to be an ideal doctor. An ideal doctor is one who is knowledgeable, who is who knows his area of specialty. An ideal doctor is one who is compassionate, who is able to understand problems, not just the medical problems, but the problems that the patients encounter, be it social, financial. A good doctor is one who is approachable and reachable. I think an ideal doctor should be one whereby a patient should not feel worried or apprehensive to contact and stay in touch with. An ideal patient is one who respects that time is time. There's not enough time. Doctors always, one of our biggest enemies is time. And an ideal patient is one who takes responsibility to understand his or her condition. An ideal patient is one who knows when to reach out to the doctor and to understand what is a serious what is serious and requires the doctor's immediate attention versus what is something which is a casual question which the doctor may take some time to respond to. For example, if a patient has a very severe headache and is vomiting, I hope that the patient is aware that this could be something serious and requires the immediate attention of the doctor. But if the patient wants to ask about whether he should buy insurance and lie to his insurance agent, then I think that's considered something that you can expect the doctor to reply to you in the due course of time, and there's no urgency to it.